2025 microbiology. So I hope there is a mixed review as usual. Some find it easy, some find it difficult or whatever. But one thing is that you know that all the, if you see, yes, I'm going to write it here now. So there were totally from microbiology 23 questions. Okay, 23 questions. In that, 22 questions were from workbook only. Okay, 22 were from workbook only. In that 20 are direct questions where we repeated it and we told most important has come. Okay, I'll show you all the things with the proof. Okay, all very important. And one question that is, I can tell you, that is biosafety level. TB, which is the biosafety level, was a question most of them must not be knowing because that was actually a question for more microbiology PG students, but it has asked. Okay, that in INICET we have to expect this type of question. Otherwise, all the questions are from a workbook only. We'll talk now. Okay, maybe one or two was a little bit different way they asked, but we have it in our, it's there already. Okay, so let's start with the first question. So now you can see this question. A patient present with fever, cough symptom. Okay, so pneumonia. And then blood agar, there was a pinpoint alpha hemolytic colony. Alpha hemolytic colony, clear? We already told that whenever alpha hemolytic colony was there, it is Streptococcus viridans, or it should be two people only, right? It should be either Streptococcus viridans or Streptococcus pneumoniae, right? So whenever you say alpha hemolytic, it should be Streptococcus pneumoniae or Streptococcus viridans. Viridans, you know, it doesn't causes pneumonia. It is causing infective endocarditis. Viru, we talked about Viru, dental caries and the subacute infective endocarditis and prosthetic valve. So it's out. So only thing we have here is Streptococcus pneumoniae. For Streptococcus pneumoniae, we saw the picture only, you can say. Also, one more clue, you see the picture. There is diplococci, right? Diplococci, lanceolate diplococci was given. So this is all pointing towards your Streptococcus diplococci. It's all pointed to Streptococcus pneumoniae. So we have discussed very, very clearly. We have a wonderful vaccine. This is wrong. So it means vaccine is there. Biosolubility, yes, definitely positive. Catalase is not. Catalase is for Staphylococcus aureus. Vancomycin drug of choice? No. Penicillin still works amazingly, and also you can give ceftriaxone. We repeated it also, right? So if you see the proof, we have it down here. We already told that clearly. The all you have to remember for Streptococcus pneumoniae. Remember in 12th standard bio group, we discussed about strep pneumonia. Like that, you remember I told you. So there was this thing. So it is easy. So biosolubility is given already. So that's the answer. And also if you go down, the lobar pneumonia, everything we discussed. Same, if you see that page, everything, whatever is there, the vaccine also, vaccine is not added here. We discussed about vaccine also. Okay, so that was an easy question. So with the if you have revised it, it would be easier, but no problem. So you don't need to worry at all. However you've written, it's fine, because our ultimate purpose, if you get an INICET good ranking, excellent. Okay, that's great. If not, we know that, right? We have upcoming NEET. So you got NEET-PG exam. So you know how the questions are coming. So accordingly, you can prepare and you can get very good marks in that one. Okay. So idea is there. So more revision, more solving questions, and attending or leaderboard in ADRPLEXUS will definitely make a lot of, you will improve a lot. Okay. So no need to worry. Okay. Now next question. You see here, when you go to the next question, another question which is very expected only, and HIV retrovirus. HIV or retrovirus positive, whatever is given, doesn't matter. The patient is presenting with again a low-grade fever, cough, and hemoptysis. Typical symptom of cough, low-grade fever, and I think for weeks or month must have been given for sure. I didn't get it. So hemoptysis there. Chest X-ray image was given. So it's basically a radiology micro mixed question. So you all the fibrosis sort of things were there. So what is mostly diagnosis? With the HIV patient, we repeatedly told in HIV patient, the most common infection is tuberculosis only. So with that, we have already came to conclusion that it is tuberculosis, right? So tuberculosis also here, though you can see in the next picture, there we clearly said that if you go to tuberculosis, it's down only the symptoms will you see, cough, hemoptysis, fever, everything was given, and we told most common infection is HIV. Clearly mentioned. Also your X-ray picture, everything was given there. So that question is directly from a workbook. Okay, that's obvious, and I'm sure you've done good. Otherwise, no problem. By revision, you'll get it better and better. Okay, so your answer is tuberculosis. Tuberculosis we answered. Okay, fine. Next one. Biosafety level only I told you, because this is an unexpected question. Mostly it is for PG students we thought, but now they've asked here. Biosafety level, we have different levels. 1, 2, 3, 4 we have, right? So microbiology BSL, biosafety level. That is, we use different type of cabinet to work. Okay, for the individual microbe, we have different type of cabinet based on the severity. So actually for tuberculosis, it is 3, because TB comes under a risk one. This is comes under the risk bacteria. So like your especially Mycobacterium tuberculosis is very important. So it comes here only. Okay. So you can add your West Nile, yellow fever. These things will come here. Okay. Yellow fever, etc., etc. And PSO is the most dangerous ones. Okay. Maybe in next NEET-PG if you get the 4 is most dangerous one where you work with your Ebola, Marburg. Okay. The most dangerous one, filovirus groups. Okay. That we will know from hereafter. Okay. 1 and 2, one is like basically like your E. coli and all. And two, some other given more like example salmonella, your salmonella or your staphylococcus aureus, these people, okay, staphylococcus aureus, okay, fine, they are comes in this category. So now hereafter we'll remember Mycobacterium TB, M for Mycobacterium TB, M is equal to 3, something like this you can remember also. Okay, so we'll discuss that for we'll have more questions and discussion practice things for your upcoming NEET-PG we will have. Okay, so that's fine. So TB question is done. Expected. Look at this question. This question, all you have, this picture, somewhat like this picture came. The clue is I'm not going to touch anything. For me, what is touching my eyes is this EF2 factor. This EF2 factor is just striking my eyes. Okay. This EF2 factor is coming just in front of my eyes. So what I'm going to do is, just a second, excuse me. Yes. So what I'm going to do here is, you can see here, this one, once again. Yeah. This EF2 factor is here. This is striking me, and ADP ribosylation EF2. Okay. We discussed many times in general topic also. In general, that's what I told, general culture toxin is very important. You will always have question, and exactly what they did is they have asked the question here, right? So that is what EF2 factor means itself. You know, only 2 bacteria can do this. What are they? One is your Pseudomonas. If you remember, the shortcut I told was DPS, decreased protein synthesis. D is diphtheria, P for Pseudomonas. Their mechanism is to inhibit the EF2 factor. S for Shigella, Sheila anti, 60 years old, decreased protein synthesis. I repeatedly stressed that point. No? See, now they asked it. Okay, it's expected only. So EF2 ribosylation. So diphtheria and Pseudomonas. So either 2 possibilities are here, right? So we'll see what is possible. So here more, it is more like you have to see what type of two. One is the phage mediated that we given. Yes, they are more thinking about diphtheria here. Okay, Pseudomonas, nothing, no point of Pseudomonas is given here. Here it's more related to diphtheria they've given. So it's easy. Exotoxin, yes, definitely it is an exo. They asked you which is the incorrect statement. Okay, incorrect statement. So exotoxin, yes, it's a phage, definitely. So I told most important in genetics, they'll ask you phage or lysogenic conversion, phage mediated means diphtheria. One is diphtheria, other one is Vibrio cholera and Shigella. They are and botulinum also, but usually this one will as we discussed very well. Okay, because myocarditis, most common complication of diphtheria. Myocarditis repeated in a lot of questions. Also, we discussed in our ADRPLEXUS classes, main class, and also in test and discussion. Also, it was repeated many times. Okay. And most potent toxic, no, that was usually botulinum, and we have botulinum toxin, the most potent toxin wave. That is the wrong answer. So look there, we have everything we've discussed there already in our workbook. So we have given a clue also, A, B, C, D, E. This is one of the thing mechanism. Okay, it's not mentioned. It's here. EF2. See, elongation factor, ADP ribosylation you have. So it's all toxin method genetic we told already. Toxin, that's a phage method, you got it. And then we written here, myocarditis most common complication, you got it. So everything, whatever we added, it's here only. Okay, so that's all. We also told it's a toxinemia basically. So that is right answer. Okay, so you got it. So that would have been correct answer. So again, no problem. You will improve like this only. Okay, no need to worry. Next one. 5th question. Which of the following are correct regarding, we are in bacteriology now, okay, bacteriology. Which of the following are correct regarding rheumatic heart disease? That's rheumatic fever they've asked mostly, if I'm not mistaken. So that is basically Jones criteria. So here, before going to Jones criteria, Asgauss body, yes, we discussed about it. Asgauss body, it is there. Asgauss body is standard. Group A, beta, hemolytic streptococcus costivation, yes, definitely. Myocarditis, yes, myocarditis, the whole heart is affected, we told. The entire heart, endocarditis, myocarditis, pericarditis, all are affected. Aortic valve rupture, no, we never read anything like that. Aortic valve rupture, if that was given in the option, that is not there. Okay, and see, same again, which of the following is not a Jones criteria? Other one is, they said no, not. Okay, they said it is not a Jones criteria. Okay, it is not a Jones criteria. I'm sorry, one second. Here it is not Jones criteria. Okay, so again, same. I don't know it's the same question or different question, but whatever it is, here there's a different option. Carditis, fever, definitely. Erythema nodosum, yes. Erythema nodosum. That is the important point here. Okay, erythema nodosum. Prolonged interval, yes. It's not nodosum, it is marginatum. So if that was there, that is wrong option. Okay, whatever given, you just predict it. Okay, so look down. Asgauss body, repeatedly every point we discussed, it's there. Asgauss body, we told Asgauss nodules, I mean rheumatic fever. It's caused by Streptococcus pyogenes A. Yes, so under that autoimmune diseases, we had this one, right? We had rheumatic fever and post-acute glomerulonephritis. So in this one, in rheumatic fever, as per body has come, and in Jones criteria, shortcut JONE, yes, J for joint migratory arthritis, and your heart is involved, of course. And then nodule, subcutaneous nodule, erythema marginatum. It was not nodosum. Nodosum is because some drug toxicity you can get it, and some other autoimmune conditions, but not in microbiology related, right? So you can easily rule out when you put out that answer. So that is okay. That is expected question. So we have to be thorough in upcoming NEET-PG exam, FMG, whatever. You're going to be thorough with that thing. Okay. So good. So that one we have done. Okay. Fine. Now next one. Which among the following is an obligation? So I told the first page of our discussion itself in general bacteriology was that only. I don't know you guys remember. It was basically capsule and then this intracellular. I told list of bacteria important, microbiome, tuberculosis, brucella. They all are very, very important. They might ask, we said. Also, two special bacteria, if you remember, if it's in the rickettsia topic, okay, if it's the rickettsia topic is under rickettsia, end of the rickettsia, I told two better. And also we have mentioned there, it's AIMS favorite question. INI-CET means AIMS means what INI-CET people, they frequently, been a while, they haven't asked for many years now, expected. And whatever expected, they asked, okay. So there were two bacteria, remember the shortcut was megaberry. So one was Ehrlichia, Anaplasma. Ehrlichia EM. So inside the monocyte, you see mulberry inclusion. In Anaplasma, it is inside granulocyte. So both Ehrlichia and Anaplasma, both are intracellular. So what you see this mulberry or morula inclusion body intracellularly, inside the cell, right? So that's the answer. So easily you would have, if you check this once and we start, told repeated also, I repeated, it will come, you should be careful that it came. Okay. So it was Ehrlichia chakensis. Okay. Now what is here? Whippley, we're not interested only. That is totally not at all attending. And Stenotrophomonas is again like a pseudomonas, okay, infection. Calamity-bacterium Kaliamma. Kaliamma, you remember, right? We told Donan, genital donovanosis, and what he eats beef, with the safety pin. So that is totally different thing, safety pin, but it is not intracellular, it is extracellular. So that is totally different story. You would have cut it. That is granuloma inguinale disease, right? So easy. So Ehrlichia, Anaplasma only. So you got this one. So it is correct. Okay, fine, excellent. So we did this one. Now, next. In bacteriology, bacteriology, this much question. Now virology we are going. Okay, virology again. You can see first question. They said there was a picture like this. Some virus was given. I don't know inside virus this L1, L2, E6, E7 is mentioned or not. That is one clue. If they've given you these proteins and all, this L1, L2, L3 protein that we studied very well in our class we discussed. So that is HPV only, human papilloma virus only. Even if it is not, when it comes skin and especially you see all the almost all the layer, but you see mainly superficial layer here, epithelium, cornified, granular, this layer when it is affecting, that it ends up getting the warts, different type of warts like lesion, right? So when you talk about warts or whatever, then automatically your mind should think about HPV, right? HPV virus. So if it is going to HPV virus, you know that HPV virus is a happy virus. It comes under DNA virus. No, DNA only we said HHA, PP, 3 P's, and 1 P is papilloma. So under this only it is coming. Okay. So RNA is totally wrong. Even if you think in herpes form also, if you think maybe it's herpes zoster or herpes virus also, your first option you should rule out. It is gone. It is not. Okay. Now, oncogenic, yes, HPV, if we consider HPV, it's oncogenic is a correct option. So that is the right option. Okay, it can cause cancer. Vaccine not available? Yes, that is wrong because vaccine is the main thing here. HPV, we discuss very much. Gardasil, Cervarix is there. So vaccine also vaccine is not available is a wrong option. Vaccine is available. Most common manifest dental also definitely not. It is warts or cancer. Usually warts or it is cancer, cervical cancer, right? List of big cancer. So HPV is always expected. Only one question will come. So this time they've asked like this. Okay. So whatever the picture they've given, so this oncogenic virus is an easy answer to choose. Okay, that's the correct answer. So here what we have discussed, if you go here, yes, exactly all the things, all the proteins, first part itself is a proteins only we told. That's very, very important. So we discuss. And apart from that, what we told, anything skin. So skin only, it is when it's affecting that layer, you already know that skin layer, you end up getting the warts. Okay. Or condyloma, these type of things. Okay, so in that way, there is clues. There is a lot of clues that this is one of the questions where not directly, but then we have all the clues, right? And we discussed all the vaccines and everything was discussed. So it's easy. Okay, there's very less chance that a lot of clues that you not make mistake. All the vaccines, everything was there. Okay, fine. So that question I think you did correctly. Otherwise, also no problem. Don't worry. This question also I stressed. If you remember, please remember in hepatitis B virus vaccination, healthcare worker has some importance, okay? And we expected in INICET, it has come. Okay. So what happened? A healthcare worker has a needle stick injury, and his HIV B load is the patient who had a high HBV level and HB is positive also. He had completed now this healthcare worker has completed 2 schedules of vaccination and also non-responder. So what is the next purpose? Go to the page. If you see there, we discussed in page number 156 in your workbook, there's separate column just for them only, immunization for the healthcare workers. So it's mentioned here, healthcare workers, if once protected, they no need booster. Even if the titer is less than 10, they don't need a booster. Okay, that means even if they exposed, the titer is less, but suppose if they got exposed to a needle prick injury, okay, what happened? No need to give the vaccine. Even after receiving 2 series of vaccine, it still is less than 10, till his HBsAg is anti-HBsAg still less than 10 means it's called non-responder. For non-responder, after 2 schedules of vaccine, three doses, 2 should have taken, still it's less than 10 means you no need to give the vaccine. That was the main point. If we once protected, no need booster at all. So vaccine is out. No vaccine business here. So either automatically immune cells, sensitized, it will produce the antibody, or we are going to give immunoglobulin only. We are going to give antibody only, right? So you go to the option now. So that is the easy one, right? So no vaccine. Main thing is there is no vaccine. You shouldn't give vaccine. So see here. So what do we have here? Full dose of vaccine. The word vaccine itself is out there. Wherever there is vaccine, cut it out. So it's only immunoglobulin. So what exactly was given, we don't know. But 2 doses of HBIg means, yes, but then how? That is important. Not immediately you're going to give, right? First, you'll give 1 dose of HBIg now, and another one after a few weeks you can give. Okay. So more relevant would be D. More relevant would be D option. Okay. Because there shouldn't be any vaccine option at all. Vaccine is cut. Because after 2 schedules, also still he's not responding. Your healthcare workers level is your anti-HBsAg is still less than 10 means, then there's no use. So this is the option. So we have discussed that also in our class, HPV, right? Okay. Sorry, hepatitis B virus. Okay, we have discussed this in hepatitis B virus, right? Next one. And yes, and also there also we mentioned it, that is very important. That question was important. Now, most common cause of adult gastroenteritis. So usually we repeated many times, they will ask pediatric, it is rotavirus. Now for change, adult virus, that also we mentioned there. We mentioned there, if you see rotavirus down to the page number, it's near to the rabies. Okay, near to the rabies virus, 174 page number. We told that expect this time Nora will come any time. We told Nora Fati, we told she's growing where? Norwalk. She's going to cruise ship. Nora virus is going to cruise ship. And in cruise ship, what? She's going to eat a lot of food and she gets what? Diarrhea. So we told most common cause of viral diarrhea in adults. It's a clear, direct question. We already mentioned it. Okay. So that question, if you have made mistake also, no problem. Next time in upcoming exam, you're going to revise very well and you're going to write it very well. Without any mistake, you're going to correct it right. Okay. So your answer is norovirus. Very simple. Okay. Children rota, adult it is norovirus. Okay. Everything is mentioned there. Okay, fine. Life cycle of microbe is given below. Identify the correct statement. So NIFA has been repeated again and again. I already told NIFA itself, because see the clue, the picture, I heard there was a bat. So you have a bat there, and the bat after eating the fruits. See, there's a fruit. So it is basically the fruit bat. So it's eating the fruit. So it is a fruit bat. Fruit bat, and pig is there. Pig is basically the reservoir, right? It is a reservoir. So the clue, everything goes to fur. I told fruit is fal. Fur, nifa, fal, right? Nifa sounds fal. And here also I told nifa, enka, fur, encephalitis. Everything is there. Everything in that rhyming only we got all the things, right? So, and definitely it's not a happy virus. So it is not a DNA virus. So it is not a DNA virus, correct. Human actors reservoir, not at all. We told repeatedly the reservoir, amplifier, everything here is pig only. Here the reservoir should be the bat. Fruit bat is the reservoir. Your pig is the amplifier. Better to write pig as the amplifier. So the reservoir is usually the bat only. It is the fruit bat. Fruit bat is your reservoir. Fruit bat is your reservoir. 100% mortality? No, not that much. It is risky, but not that much. 20 to 30% only. Okay, not even. It's almost equal to Japanese encephalitis. Cause encephalitis? Definitely yes. So your answer is encephalitis. Fur, nifa. Okay, so do we have a proof? Yes. We've discussed it very nicely with 4-5 points only we discussed there. We told, see, remember nifa, encephalitis, palm fruit, Kerala, pig is the amplifier, reservoir is fruit bat. Okay, and PCR you have to do. Even Ebola also with it, fruit bat is also there. Also it is a reservoir we discussed. Okay, so we're done with that one, right? It was an easy one. Only with revision comes easy, but only when we were revising it again and again, and giving a lot of leaderboard question in our ADRPLEXUS, practicing more and more questions. That only will make you perfect, right? Okay. Now parasitology. Now parasitology, you see this, the question was, the picture was given, just it looks like a strawberry. You don't even, they said this is a condition and it just looks like a strawberry. We repeatedly told, okay, this is very easy question for an INI-CET question, but still it's fine. So we told who loves strawberry? Our Trisha. Trisha likes strawberry. So even the picture also was given there. Trisha likes strawberry and she likes green and she likes the pearls. But they didn't ask about pears and green. They asked about strawberry vagina or cervix. So automatically it goes to trichomonas vaginalis. Right? Easy. Bacterial vaginosis is not this. It's all discharge. It's type of discharge only we talk there. Thin grayish discharge. Cervical cancer is different. Not at all included. Gonococcus not will come here. Gonococcus we have usually cervical discharge. So here directly, it's all pointed to trichomonas vaginalis. Okay. We also told that also, remember the vagina is also called colpitus macularis. Colpitus macularis or strawberry vagina we told. Okay, different type of strawberry we discussed. So it's okay. Profuse green for the discharge. Okay. So that's always expected only. There is no, most of the exam Trisha will be there. You can't avoid Trisha, right? Okay. Now what about this question? Here you see the patient with the pulmonary symptom. Okay, patient with a pulmonary symptom, fine. And a chest X-ray, he showed opacities in the lung. Lung is there. Okay, lung is given a group, and there is a clue for crab. Enough. Crab is enough. Crab is more than enough for your answer, because first of all, itself you can see. First is that we told crab or crayfish means para kara, right? Para kara, para kara. We told para is equal to kara. So why para? Paragonimus westermani. Paragonimus westermani. That is the answer. That is why I told Paragonimus westermani. Westermani, or if you forget also what we told, money has a lung problem. Our money has a lung problem. We discussed like that only, right? So these things come under which one? These things comes under the trematodes. In trematodes, we discuss sisters can play flute. So this category, okay, this category, if you see, it's there. We discussed everything. It's in, I couldn't find the page number. It's in parasitology. If you go to cestode helminths, you can find this easily there, okay. So sister can play flute, all of them. These are flutes. And then what we do, the most important thing is operculated. In operculated, yes, TD we told. In T we told all the trematodes are operculated except schistosoma, another clue. So you look at this egg. In this egg, whatever the picture you got, I heard there was a lid-like thing. So if there is a lid means, then definitely it is an operculated egg. So operculated egg, so definitely another clue you got, it is trematode. Trematode, that's enough. Now, when we went to the treatment, we told all the cestode and, yes, Paragonus westermani, we discussed it very nicely. Crayfish is there, and in lungs, eggs you see in the sputum, and then usually it's mentioned the sputum or even stool, doesn't matter. Both egg if you see, and if there is crab, then it is Paragonus westermani only, right? And we told your operculated egg was there, and then most important treatment. In treatment, we told what? For all the cestode and trematode, we give treatment praziquantel, except for your fasciola hepatica, we are giving triclopentazole. Phase tricolor. Otherwise, all praziquantel. So your answer is very clear. Previous exam, they asked triclopentazole for fasciola hepatica. This time they asked this one. So your answer is Paragonimus westermani, praziquantel. Finished. That's all. Not ivermectin, not DEC. DEC for, elephantiasis. Ivermectin, we got a strong ladies heat. We got strong ladies, and one more is river blindness, IVR. Okay. So that is for other discussion. Okay, fine. So we did with this. So everything was there. Every clue was there. Many clues, not one or two, like many clues you had there. Okay, fine. Next question. Identify the organism. This picture, you don't even, the only clue you have to remember is everywhere there is O. So everywhere O. So it is hookworm. Hookworm. Very easy. So hookworm, only two things. Either Necator or it is Ancylostoma. This is the two things. Do we have in this option? Yes, we got Necator. Even if they give Ancylostoma, that is also right. Ancylostoma, whatever they've given. So this is Necator's correct direct question. So no any mistakes in this question. Yeah, we have discussed very nicely, and you can see the clue was given there. Everything is O. So hookworm. Everything becomes hookworm, right? Clear. So, and that includes two, but that is Necator and the Ancylostoma duodenale. That's all. Okay. So we're done with that one. So easy peasy. And to my surprise, in the same chat, cutaneous larva and visceral larva migrants, you had a question, right? And matches the following. I told this type of question come. That's what during our in-between sessions also in the workbook, we were discussing the questions like this only. So this is becoming nowadays popular in our INICET NEET-PG questions. Okay. So that means in one question, 4 questions can be covered. Same like this. See, you're seeing it. So this chart, everything, if you go to your page number in a workbook, page number 280, all the points were there in the same page. It's like they've just copied and pasted there or what. I was really very happy. Many of the pages are like that same page. Everything was asked. So you see here, cutaneous larva migrans was given. Yes. Ancylostoma, Necator, and strongyloides were added. Visceral Toxocara, most common we told. And I told 2 itch is important. Ground itch would be your strongyloides. Swimmer's itch would be a cystosoma. Everything in one page. I'm also a little bit surprised. Come massively from same page. It is not in textbook also. It's not given in this pattern. I was like, wow, that's nice. I was happy that our students, ADRPLEXUS students, would have been very happy seeing this one. Yes, but okay, no problem. It's all there. All you have to do is practice, practice. Easily you'll get it. Okay, it'll be very easy for you people in upcoming exams. So swimmer's itch. Yes, for sisters will swim, right? Sisters swim. So we're going with the cystosomiasis. Visceral larva inside. So it is Toxocara. Cutaneous larva, ancylostoma, perfectly. Larva currents, who is like a current? Strong ladies or like current. That's all. Okay. So whatever option, if it is matching this B4, C2, and this thing. Very simple. Everything was there, right? So it was an easy one. So it was an easily question, right? Larva currents is there also. You can see larva currents, females are like a strong, like a current I told. So strong females, finished. Okay. So very good. So that also was there directly. Another question. Clue is there. Contact lens wearing, present with keratitis, that's acanthamoeba. Okay. Or Pseudomonas can be. But here I saw in this picture, it is more like that only. So whatever picture they're given, they told something white color like this was. This picture we repeated many times. We studied this picture. So this picture is calcofluor white, even if there is no clue. So though mostly we said what calcofluor white, I remember mostly we talked about fungal, right? Fungal, but it's not necessarily always fungal. Some parasites also there. One of the examples is acanthamoeba. But for you important is the picture. In that picture only you can see that little bit whitish color thing is there. Definitely it's not a bacteria. Definitely it's not bacteria, right? Bacteria, we saw aurum and rhodum in TB, it's different. In orange for malaria, that is different. And this one, so that is expected only. One fluorescent stain, always it's there. So they ask this thing, indirectly they ask like this. So definitely this is a calcofluor white stain. This is calcofluor white. Sorry, 1 second. This is basically your calcofluor white. Calcofluor white stain. That's all. Okay, that's not gomeromethamin is not like this. There will be black color. You have black color basically bacteria, you can see. Zn, it should be pink color. Giemsa stain will be violet color. So only thing is calcofluor white. Like this also you can make the answer correct. Okay, calcofluor white stain, right? Okay. Fine. So that was there. Yes, everything was there. No need to say only. You know that we stopped acanthamoeba means if your ring keratitis, ring infiltrated. We said it's very painful. Even if I don't know if they've given this type of question, whatever they've given, every point should be there. It was there already. Okay. So and then whatever the picture they're given here, if you do a fluorescence, you can get that picture. Okay. So a lot of clues were there. Very good. Okay. Now that's what I'm saying. See that same page. That acanthamoeba and trichomonas, what we discussed, it was a question. 2 different questions has come, right? So it's good. It's good. That means we are doing in a right way. So yes, you will do better. Even if you're not doing done this time, the next time you're going to get absolutely very good marks. Okay, no need to worry. So in occult filariasis, again I stress this also, I told again, occult filariasis, microfilariasis not seen in the peripheral blood, we told. Instead, where it is present, the disease name itself, other name for the disease is called tropical pulmonary eosinophilia. So it is lungs, mostly lungs, but it can be lymph and also some lymph nodes, and sometimes it can be kidney. So here, of course, lung was mentioned clearly. So that is most common one. So what is that? So we discussed there. Go to the yoga. If you see your page number, which page? I forgot. The page is not mentioned here, but doesn't matter. You go to elephantiasis and see. In elephantiasis, this topic, it's mentioned very clearly. Occult filariasis. Other name is tropical pulmonary eosinophilia. It's a given. So everything is there. Eosinophilia, I gave clues E for elephantiasis. Remember, E for elephantiasis, E for eosinophilia. To remember. So there is no microfilaria in the peripheral blood. Yes, it's not. It's very mentioned. Microfilaria is not there, but your IgE microfilaria antibody will increase. But we didn't mention it is in the lung or whatever. It doesn't matter. So clue is already there for you. It is lungs. The other name itself is the tropical pulmonary eosinophilia. So it is lungs. Okay, finished. Okay. Now that question is done. So it is lungs. Now, other one, mycology. Yeah, we're going to last one, the mycology part. In mycology, you see, which of the following demonstrates the positive test of the image shown below. So that was, we discussed many times and we told that germ tube, right? Germ tube. So that what you're seeing there was a germ tube. So germ tube means itself, you know, only 2 people. Who are the 2 people? Candida albicans and the dubliensis. So this is germ tube. This is what you're seeing is the germ tube. So only 2 people. One is your albicans and other one is your dubliensis. And also remember, we discussed how to differentiate also both. The other name, of course, germ tube is otherwise called. It's there in your Candida topic. It's there. Albicans, Reynolds-Brody phenomena. Two people, one is albicans and dupliances. Both are giving germ-2 positive, chlamydia4 positive. How to differentiate? Your albicans will grow more than 45 degree and hypertonic saline. Keep it for upcoming exam. Upcoming exam, we are going to discuss those things also. Revise it, revise, it will come. Okay, so finish. This is a direct question, albicans. Okay, right. And other one, treatment of choice for cryptococcal meningitis. Cryptococcal meningitis, you know, it would be in a pharma or a medicine or even our microbiology, everywhere it is taught. Okay, so no mistake in this one. So treatment of choice cryptococcal meningitis comes means is of amphotericin plus flucytosine. We have discussed it many times. Okay, so here also we have it. We have discussed very well. See last part, cryptococcal meningitis, everything, last amphotericin plus flucytosine. We have mentioned it. Okay, we told that it is repeated. Okay. That's all. So that is also done. This one, we even, this picture, what we even drew also. We told, please draw it because aspergillus mucormycosis, one question examiner's favorite and they will always ask. And we draw the picture. If you remember the picture, you would have mentioned. Okay. Anyways, it was given a patient presents mass over the some wall, metal wall. Gomori methanamine silver stain was done, which is usually done for fungus or anything, but usually fungus we are doing. So you can see you're seeing black color like this. Now, what is that? So that is your what? Acute. You see the picture. It is like acute angle. Okay, acute angle. Some places you can see septa also. So acute septae hyphae. When you see acute septae hyphae, yes, aspergillus, aspergillus, aspergillus. Directly it's there. Clue. So, okay, so no problem. If you make mistakes again, I'm saying no need to worry. So these two are out because these two are zygomycosis or mucormycosis, enemy of aspergillus structure, right? Totally different structure from the aspergillus. Okay. So this is answer C. So see that even we drew, if you remember, I always say please draw aspergillus mucormycosis with your hands, not to forget. So we drew this picture, aspergillus also. So branching is also called dichotomous branching, acute septate hyphae. Finished. Direct question. Okay, so this is not to be made mistaken. So probably next time they might ask you the mucormycosis. So let's be with the mucormycosis questions also. Okay. They won't revise everything. No need to worry. You'll be revising again, giving more our leaderboard exams. Okay. And of course, you will get it more better, stronger. Okay. Right. Now all the disease caused by thorn prick. That just directly, it's just a direct question. Okay. You see, we mentioned there also down. For sporothrix chancre, the transmission is by thorn prick mentioned. Other one is your chromoblastosis thorn prick we mentioned. Okay. For another, for your mycetoma, we didn't mention directly. We wrote barefoot. We have written barefoot. We have written. Usually it's like almost like a prick only, barefoot somewhere injury. It's basically injury. So we can accept it also. So that's also correct. Thorn prick for sporothrix mycetoma, correct. Dermatophytes, not dermatophytes, a ringworm infection. Why it has to? Because of this thing. Even if you forgot also, you can think like this. You can tinea infectious, no, tinea capitis, but this, no need to take. So that can be done. Okay. So these things only, they're subcutaneous, MRCS. We don't know MRCS. So in MRCS group, only 3 of them, they come here. Mycetoma, your chromoblastos, sporothrix. So rhinosporidium is different. That doesn't come, that's different way. But this one, basically all thorn prick, all these things. Okay. Subcutaneous fungal infections. That's all. Okay. So all the proofs we just saw. So everything is from here on. So easy, ECPC. Now, next one. Last one also, it was just direct question. Same, if you see the same page only, it was there. Just these 3 sporothrix, the previous picture, and this one, you open our workbook and see, you will be shocked. It's just in the same page, all the things. It's like they choose from that page only all the questions. Like that it is given. Okay. So that was really making me happy that I hope our students would have done well. If not, also no problem. All you need is a revision. We have enough time for NEET-PG. So revise, start. Okay. Revise, and practice more questions. You will get it. Okay, so remember, this is a mycetoma we said, and we draw the picture also, same picture, I think similar picture. So there was discharge sinus, and we told 2 things, actino and the eumycetoma. The causative agent of fungus here is Mozzarella mycetoma. Then what? Black. I told anything fungus, remember black. Bacteria, the pus is usually yellow color, so put it into yellow. That's the easy way to remember, I told. So exactly they given you the question. They have fruit with the black granules. Granules will be black and black discharge, black granules. So your answer should be definitely Mozzarella, which is a fungus. Definitely not the actinomycetoma. These two are bacterial. Eumycetoma, actinomycetoma. Where this is your eumycetoma. EF. Okay, all the clues were given there. So just go through it once. That's all. Okay. Now what happened? These are the questions asked. What was not? Even PCR in immunology molecular PCR also we did also. We gave shortcut also. If you remember. You go there. In the starting, it's in the general microbiology. At the end of the general microbiology, okay, just before systemic, you can see the page. I told that when PCR comes, I told also many times it's been a while, they didn't ask, so we have to expect. And they asked. What they asked? PCR. Shortcut was what? Eat, drink, and enjoy. Or exercise. For some place I told exercise, some people enjoy, whatever. So E should be extraction, then denaturation, annealing, and extension. Do we have this one? Extraction is not given in the option. So they directly went to what? Denaturation, right? So you have a denaturation, annealing, and extension. Denaturation, annealing, and extension. Your answer is A. That's the sequence. Correct. Hybridization will not come. Hybridization and the PCR no link. That is totally hybridization, that's blotting technique, no, blot, southern blot, northern blot, those things, no. And even after PCR you can do, but that is not making any sense at all. That's out. Okay, so you can, that way also you can cut it to hybridization, and extension will be always the last process, not the initial one. So this is always out. Denaturation is fine, but then again extension is the last one, so again this is out. So your answer is A. Okay, so these are 23 questions, and you can see that except that BSL, rest all we have maybe one or two little bit up and down. Other all things is direct, and that is places where we have marked also Q. That questions only they have asked. Okay, and the last one, what was the thing? 24th one question is there. That is the sciences they asked. Yeah, I hope they asked this question only. You know, Nobel Prize was awarded to which diagnosis? So this I can't take, it's completely micro concept because it will be for all, no. So medicine, patho, for everything, no. So I think that was when we finished the class. That time this prize was also not awarded. Yeah, in Chennai class and Madurai, that time this prize was, this is latest one. So I'm sorry if we didn't tell. But then yeah, the Nobel Prize was given to which one? Of course, it was for the peripheral immune response, autoimmunity. It was autoimmune immunity, remove that Fox gene, FOXP or IMAX gene, which usually prevents the autoimmune diseases, right? If any mutation happens, then autoimmune disease will happen. So that we have to little bit revise. That's okay, not a problem. Otherwise, this much only. Okay, so that's all we've done, and I'm so glad that questions are directly from. So this gives you a positive hope that for microbiology, you go through the workbook very well, and as the same advice only, revision, 5 to 6, 7 revisions, please go and follow all our ADRPLEXUS leaderboard questions, attend maximum possible, whatever platform you're forming, please read the questions, write it in the workbook itself, same book only, keep it for all, for complete exam, and revise for upcoming exams. Okay, you will do wonderful. I'm sure you guys are going to get excellent rank in INI-CET itself. If not, I know many students are preparing for NEET-PG only. Sufficient time, 6 months more. We have 6 months more. Okay, so now it's a put your effort, do it, and you will become, you'll get best ranks, and you'll make all of us proud. Okay. Okay. Thank you, doctors. Thank you. We'll see you in another session. Bye.